Hello, welcome to Anatomy DAHAR series. Today's our topic is about the larynx, membranes and ligaments of the larynx, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Membranes and ligaments of the larynx. The skeletal framework of the larynx is interconnected by many fibrous membranes and ligaments. Each of them are arranged in two groups, extrinsic and intrinsic group. Number A, membranes. Extrinsic membranes are number 1, thyroid membrane, 2, cricotracheal membrane, and intrinsic membranes are 3, quadrangular membrane, and 4, cricovocal or cricothyroid membrane. B, ligaments also consists of two groups, extrinsic and intrinsic group. Extrinsic ligaments are number 1, Epiclotic ligament, 2, Thyroepiclotic ligament, 3, Cricotracheal ligament, 4, cricothyroid ligament, and intrinsic ligaments are 5, Vestibular ligament and 6, vocal ligament. A, extrinsic membranes. Let's see two diagrams here. This is an anterior view of the larynx and the hyoid bone. You can see two thyroid laminae here. This is upper border of the thyroid cartilage and this is superior horn of the thyroid cartilage. When you look from the right side, this is the upper border of the thyroid cartilage and this is the superior horn. This is body of the hyoid bone and greater horns of the hyoid bone. When you look from here, this is the body and the greater horns of the hyoid bone. Let's see the first membrane, which is thyroid membranes, that is between the thyroid and hyoid bone. So when you see here, thyroid membrane arises from the whole length of the superior border of the thyroid cartilage and also from the superior horns of the thyroid cartilage, whole length and from the superior horn. This membrane goes up behind the body of the hyoid bone and attached to the upper margins of the body of the hyoid bones. Here you have to remember that membrane goes up behind the body and attached to the upper border of the body of the hyoid bone. So between the body of the hyoid bone and the membrane, there is a bursa present here. If you see thyroid membrane, here's a little opening is there. So this opening is passed through by internal laryngeal nerve and superior laryngeal vessels. That means artery and veins will go through this opening of the thyroid membrane. Second membrane is cricotracheal membrane. This is anterior view of the larynx. This is cricoid cartilage, inferior border, and this is first ring of the trachea. Cricotracheal membrane is between the lower margins of the cricoid cartilage and attached to the first ring of the trachea. This little small space is filled with the cricotracheal membrane. A, intrinsic membranes. The third one is the quadrangular membrane. This is the diagram of the larynx, sagittal sections. This is anterior and this is posterior. So you are seeing the inner surface of the right wall of the larynx. This is cricoid cartilage. This is arytenoid cartilage. This is epiglotic, and between the arytenoid cartilage and epiglotic, we have airy epiglotic folds. That is, the mucosal fold is here. This is vestibular ligament, also called false vocal cord. Now we are going to talk about quadrangular membrane. This is quadrangular membrane. It is made up of fibroelastic membrane. It extends between the arytenoid cartilage and the epiglotic cartilage. Its posterior border is short, but its upper border is long, formed by airy epiglotic folds. Its lower border is free and formed by the vestibular ligament, that is, false vocal cord. Two airy epiglotic folds, these airy epiglotic folds form the margins of the laryngeal inlet, which is oval in shape. A. Intrinsic membranes. Number 4. Cricovocal or cricothyroid membranes. Let's see the diagram. This is again sagittal sections of the larynx. We are looking the inner surface of the right wall of the larynx. This is anterior. The structures are, this is cricoid cartilage, this is arch of the cricoid cartilage, this is arytenoid cartilage, and this is its anterior process, also called vocal process. This is thyroid cartilage. Deep surface is the angle of the thyroid cartilage. Now, if we talk about this membrane, cricovocal membrane, this membrane is attached inferiorly to the upper border of the arch of the cricoid cartilage. Above, it forms a free margin but thickened and called vocal cord. Posteriorly, it is attached to the anterior process of the arytenoid cartilage. Anteriorly, it is attached to the thyroid angle. Group B, ligaments. Extrinsic ligaments. Let's see the diagram. This diagram is again sagittal sections of the larynx. This is in front, anterior. This is posterior. We are showing the inner surface of the left wall of the larynx. The structures are, this is body of the hyoid bone. This is epiglottic, anterior surface of the epiglottic. The lower part of the epiglottic is narrow, called stalk of the epiglottic. This is thyroid cartilage. This is posterior surface of the thyroid cartilage, which is thyroid angle. Next is, this is cricoid cartilage. Below it is first tracheal ring. Now let's talk about the extrinsic ligaments of the larynx. Very first one is hyoepiglottic ligament, the ligament between the hyoid bone and upper part of the front of the epiglottic. This is our hyoepiglottic ligament. Next is number 2, thyroepiglottic ligament. Very simple. The ligament is here, that is between the angle of the thyroid cartilage, that is posterior surface of the thyroid cartilage, angle of the thyroid cartilage. This ligament is attached to the lower part of the epiglottic, narrow part, the stalk. This ligament is thyroepiglottic ligament. Number 3, this is cricotracheal ligament, but this is a small ligament here between the arch of the cricoid cartilage, anterior part, to the first tracheal ring. This is cricotracheal ligament. B. Extrinsic ligaments, continuation. Let's see the diagram. This is the anterior view of the larynx. This is thyroid cartilage. This is cricoid cartilage. This is inferior border of the thyroid cartilage. This is superior border of the cricoid cartilage. There's a gap between these two borders. This gap is filled with a ligament called cricothyroid ligament. It is in fact elastic tissue and has anterior and lateral parts. The anterior part is a thick band in the midline connecting the upper border of the cricoid arch and to the lower border of the thyroid cartilage. It is also called anterior or median cricothyroid ligament. One on each side of this ligament that is lateral to this anterior band, we have a thinner part termed Trichovocal Membranes. Trichovocal Membrane, which is the thinner lateral part. We have already mentioned this one above. Group B, Intrinsic Ligaments, continuation. Let's see the diagram first. This is the sagittal sections of the larynx. This is in front, anterior. We are showing the inner surface of the right wall of the larynx. This is epiclotic. This is arytenoid cartilage. This is anterior process or vocal process. This is cricoid cartilage. This is thyroid cartilage. Posterior surface is here. Above here is quadrangular membrane, we have already mentioned earlier, and below here is trichovocal membrane is here. Now the fifth intrinsic ligaments of the larynx is vestibular ligament. This is the one. It is made up of fibrous tissue. It extends from anterior is posterior surface of the thyroid cartilage, and posteriorly it is attached to the anterolateral surface of the arytenoid cartilage here. The last intrinsic ligaments of the larynx is the vocal ligament. It is made up of yellow elastic tissue. It extends from, same like vestibular ligament, from the posterior surface of the thyroid cartilage and attached to the vocal process, that is the anterior process of the arytenoid cartilage. Structures attached to the posterior surface of the thyroid cartilage. Let's see the diagram. This is posterior surface of the epiglottic. This is lower narrow part, stalk of the epiglottic. This is posterior surface of the lamina of the thyroid cartilage. Here the midline is the thyroid angle. This is posterior surface of the cricoid lamina. This is upper border, and here is the ridge, and on each side is the fossa for the attachments of the muscles. So what are the structures attached along this area? Look here, number 1, along the midline, you can see here from the angle of the thyroid cartilage to the stalk of the epiglottic is thyroepiglottic ligament is here. Number 2, on either side of the thyroepiglottic ligament, you can see here there's a pair of vestibular ligament is here. And number 3, below the vestibular ligament is a pair of vocal ligament is there. We have already mentioned just now. So you can see from top to here, bottom here, up to here, that is one is thyroepiglottic ligament, next is vestibular ligament 2, and next is number 3, vocal ligaments here. After that, on the lateral side, number 4 is vocalis muscles, and number 5 is thyroarytenoid muscles. These things we are going to talk in next chapter of the muscles of the larynx. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.